Hi friends, this is a short video about my own reaction to a study that have been recently established regarding aspirin as a primary prevention pollen guideline based approach. So coming to the topic as such, we have aspirin can be very beneficial for higher risk individuals with low bleeding. Prevention is high risk adult aged 40 to 60 years of age. Support selective use of low dose aspirin about 75 to 100 milligram for primary atherosclerotic diseases. We can also suggest aspirin for careful bleeding. We also have to assess for careful bleeding manifestations. However, aspirin should be avoided in those who have high bleeding risk, low to moderate cardiovascular risk, elderly patients, and diabetes without established cardiovascular diseases. Clinical tools such as aspirin guide can support risk satisfaction and optimization of the patient selection. Then coming to when to consider the use of aspirin. The guidelines support selective use. Low dose aspirin 25 mg to 100 mg may be considered for primary atherosclerotic cardiovascular diseases, prevention in higher risk adults aged 40 to 60 years without significant bleeding risk. So coming to low cardiovascular risk, 42-year-old, we can see, for example, a case of a 42-year-old controlled hypertension, no atherosclerotic vascular diseases. Despite hypertension, cardiovascular benefit is minimal, so bleeding risk remains. In such patients, aspirin is not recommended or is limited in use. For second case, for example, in case of a high risk bleeding case, you should have a precaution about the usage of the aspirin, as the aspirin itself can cause high bleeding risk. When to avoid aspirin? Avoid aspirin in high bleeding risk such as ulcers, anticoagulants, low to moderate cardiovascular risk, diabetes without atherosclerotic cardiovascular diseases, age more than equal to 60 years. And the final message is that the selective use of aspirin gives protection in deserving high risk patients while avoiding harm in low benefit scenarios. Thank you.